As we mentioned in a previous video, respiratory centers in the brainstem, especially in the medulla, are responsible for setting the basic rhythm of respiration. These centers include the ventral respiratory group and the dorsal respiratory group. However, several factors can modify this basic rhythm, including partial pressures of carbon dioxide, partial pressures of oxygen, blood pH, the influence of higher brain centers like the cerebral cortex and the hypothalamus, as well as reflexes. Carbon dioxide levels is the most important chemical modifier to modifying breathing. Normally, arterial carbon dioxide levels measure about 40 millimeters of mercury. An increase in carbon dioxide levels, referred to as hypercapnia, causes carbon dioxide to accumulate in the brain. As that carbon dioxide accumulates, it combines with water to form carbonic acid. This acid releases hydrogen ions, which increases the acidity of our blood. Now, keep in mind that as acidity increases, pH number gets lowered. The increased acidity excites what are called central chemoreceptors that are actually part of the brain, of the medulla itself. This increases both the rate and depth of breathing. In this case, carbon dioxide is acting indirectly. What it's doing is causing an increase in these H plus ions. And the H plus ions are the thing that are actually modifying the breathing rate. Oxygen levels are detected by peripheral chemoreceptors. These are not in the brain or the brain stem. These chemoreceptors are found in places like near the aorta and the carotid arteries. These peripheral chemoreceptors are looking for any changes in oxygen. Normally, declining oxygen only has a slight or small effect on our breathing rate and depth. Oxygen levels must drop substantially. Remember that normally, in arterial blood, our oxygen levels should be somewhere around 100 millimeters of mercury. But if their levels get reduced to about 60 millimeters of mercury, now oxygen levels declining to that degree can act as a major stimulus to change breathing patterns. Changes in pH can modify respiratory rhythms even if carbon dioxide and oxygen levels are constant. A decrease in pH, remember that means that we are actually increasing acidity, is caused by an increase in hydrogen ions, H plus ions. These H plus ions cannot cross the blood-brain barrier, so this chemical is measured by peripheral chemoreceptors, just like oxygen levels were being measured. Stimulation of these receptors leads to increased ventilation rates. Increasing hydrogen ions can be related to carbon dioxide levels, but can also be caused by an accumulation of lactic acid during exercise, or ketoacidosis that can be caused by poorly controlled diabetes mellitus. Regardless, the increase in H plus ions causes an increase in ventilation to remove carbon dioxide from the blood. This removal of carbon dioxide should shift the chemical equation over to reduce the production of H plus ions. Because we're reducing those H plus ions, the blood should become less acidic. Strong emotions and pain can also modify our breathing patterns by acting through the respiratory centers through the hypothalamus and other limbic system structures. The hypothalamus, or activation of the hypothalamus, can lead to holding our breath when we are angry. It can also lead to increased respiratory rates when we are excited. And because the hypothalamus is the body's thermostat that's measuring and regulating our body temperature, an increase in body temperature leads to an increase in respiratory rates. and a decrease in body temperature can lead to a decrease in respiratory rates. We can also exert a voluntary kind of control over our breathing patterns. Much of what we've discussed so far, the VRG and the DRG of the medulla, the concentrations of chemicals in our blood, have all been autonomic kinds of responses. But we can exert a voluntary kind of control through the cerebral cortex. The cerebral cortex can send signals directly to respiratory muscles, bypassing the medulla altogether. However, if we try to hold our breath for an extended period of time, trying to exert a voluntary control, rising levels of carbon dioxide will eventually trigger those carbon dioxide and H plus chemoreceptors that will force us to breathe through these autonomic kinds of controls. We can exhibit some voluntary control, but that can be override by our autonomic types of controls. The lungs contain receptors that respond to the presence of different kinds of irritants, mucus, debris like dust, noxious fumes, and etc. These receptors communicate with the medulla through the vagal nerve afferent fibers. These signals will initiate a constriction of the bronchioles that reduces the ability to move airflow, but it can also cause coughing to change our breathing patterns as well. In addition to these receptors, we also find stretch receptors that are a part of the pleura and the conducting passages of the respiratory system. When the lungs inflate, it activates these stretch receptors to send signals to the medulla. The medulla responds with inhibitory signals that end inspiration and allow expiration to begin happening. As we expire, the lungs will start to recoil, which reduces stretch, so these stretch receptors stop sending those signals, which allows us to start inspiring again.